The world faces a growing health crisis: antibiotic resistance. This means that some infections, once easily treatable, are becoming harder to fight. If left unchecked, we risk returning to a time when simple infections could be deadly. This is the looming threat of superbugs. They have the potential to kill millions and challenge the very foundation of modern medicine. We must understand this threat and act decisively to avert disaster. The rise of superbugs is a complex issue with no easy solutions. It requires a multifaceted approach involving scientists, healthcare professionals, policymakers, and the public. By working together, we can mitigate the impact of this global health threat. This is not just about preserving our health, it's about safeguarding our future. Superbugs are not some science fiction nightmare, they are a stark reality. These are microbes, including bacteria, viruses, and fungi, that have developed resistance to the drugs designed to kill them. Imagine a common staph infection or a urinary tract infection becoming untreatable. This is the danger posed by superbugs. Examples of superbugs include methicillin-resistant Staphylococcus aureus, MRSA, vancomycin-resistant Enterococcus, VRE, and carbapenem-resistant Enterobacteria CE, CRE. These microbes can cause severe infections in hospitals and communities, leading to longer illnesses, increased healthcare costs, and higher death rates. The development of resistance is a natural evolutionary process. However, the overuse and misuse of antibiotics have dramatically accelerated this process, creating a global health emergency. Antibiotics have been hailed as miracle drugs, saving countless lives since their discovery. However, their overuse and misuse have come at a steep price. The more we use antibiotics, the more we push bacteria to evolve and develop resistance. It's like a constant arms race, and we're falling behind. This overuse occurs in both human and animal healthcare. Doctors sometimes prescribe antibiotics unnecessarily, and patients often demand them even for viral infections they can't treat. In agriculture, antibiotics are routinely used in livestock to promote growth and prevent infections. This practice creates a breeding ground for resistant bacteria that can then spread to humans. This cycle of overuse and resistance is a ticking time bomb. The World Health Organization, WHO, has identified antibiotic resistance as one of the biggest threats to global health, food security, and development today. Without effective antibiotics, many standard medical procedures, such as organ transplants, cancer chemotherapy, and even routine surgeries, would become incredibly risky. The impact of superbugs is already being felt worldwide. According to the CDC, at least 2.8 million antibiotic-resistant infections occur in the US each year, and more than 35,000 people die as a result. The situation is even more dire in low-income countries with limited access to healthcare resources. The rise of superbugs threatens to undo decades of progress in global health. Section 5: Real-world consequences. Consider the case of a young athlete who scrapes their knee during practice. What seems like a minor injury becomes a life-threatening infection due to antibiotic-resistant bacteria. Or imagine a new mother developing a post-surgical infection that doesn't respond to traditional treatments. These are not hypothetical scenarios, they are real-life examples of the devastating impact of superbugs. In 2017, the world was shocked by the case of a Nevada woman who died from a CRE infection resistant to all 26 available antibiotics in the US. Her death served as a stark reminder of the urgency of this growing crisis. We are on the cusp of a post-antibiotic era, and the consequences are dire. Section 6: Combating the crisis. The good news is that we are not powerless against this threat. Scientists are working relentlessly to develop new antibiotics and alternative therapies to combat superbugs. These include novel approaches like phage therapy, which uses viruses to kill bacteria, and antimicrobial peptides, which target bacteria differently than traditional antibiotics. Health organizations like the WHO and CDC are leading global efforts to improve surveillance of antibiotic resistance, develop guidelines for responsible antibiotic use, and raise awareness about this pressing issue. International collaboration is crucial for sharing information, coordinating research efforts, and implementing effective control measures. We are not starting from scratch, we have the knowledge and the tools to fight back. Section 7. Preventing antibiotic resistance. While scientists work on new solutions, we can all play a role in preventing the further emergence and spread of superbugs. The key is responsible antibiotic use. This means taking antibiotics only when prescribed by a doctor and completing the full course of treatment, even if you start feeling better. Equally important is preventing infections in the first place. This includes practicing good hygiene, such as frequent hand washing, covering coughs and sneezes, and getting recommended vaccinations. Supporting policies that promote responsible antibiotic use in healthcare and agriculture is also crucial. Each one of us has a role to play in this fight. Section 8. A call for global action. The superbug crisis is not just a medical problem. It's a societal issue that demands a collective response. It requires a unified front involving governments, healthcare providers, the pharmaceutical industry, and the general public. We need to invest in research and development of new antibiotics and alternative therapies. We need to strengthen infection control measures in hospitals and communities. We need to educate the public about the importance of responsible antibiotic use. And we need to act with urgency, recognizing that the consequences of inaction are too grave to ignore. The time for complacency is over. The time for action is now. Section 9. Reason for hope. The fight against superbugs is daunting, but it is not insurmountable. By understanding the problem, embracing our shared responsibility, and taking decisive action, we can turn the tide. History has shown us time and again that humanity can overcome even the most formidable challenges when we work together. This is not a time for despair, but for determination. It's a time for innovation, collaboration, and unwavering commitment to safeguarding global health. Let's rise to the challenge and create a future where infectious diseases, no matter how resistant, no longer pose a threat to humanity.